Hello, and welcome back to the LFA Purpose Podcast, where we offer fresh insights to help you rediscover the clarity and courage that already live within you. I'm your host, Father Leo Armbrust, and in each episode, we feature guests who share something in common in their own way. They are healers within their profession. They have allowed their passions to guide their path. I'm excited to speak with today's guest about something we tend to overlook, the connection between body and mind. When they are in balance, our minds begin to declutter and clarity can come through, which helps us to slow down and reflect. When your mind is clear, you can begin to ask yourself, what truly matters? What kind of life do I want to live? And how can I contribute to the world around me? I'm delighted to introduce to you today a very good friend of mine, Dr. Maria Bago, founder of Vitality with Dr. Bago. She is an exceptional human being and was my general physician. She is also certified and a pioneer in holistic medicine. She believes that healing begins with a clear and healthy mind. So Dr. Bago, welcome.
Hi.
It's good to see you again.
Thank you so much for having me here.
Dr. Bago, please tell us something about yourself. How did you get to be where you are today? Did you ever want to, as a child, get into the healing professions? How did you find this career?
Wow. First off, thank you for having me here. And I'm honored that you have me join you on this podcast. So as a child, I've always loved health and fitness. I did sports, I did cross country, I did football, I did gymnastics. I loved being active. I loved sports. I loved exercise, health. And I knew I was going to do something in health. So I was born in Jacksonville. My mom was from Spain and my dad was from the Philippines. I am both Filipino and Spanish, so I am a mix. My parents immigrated here when they were in their early 20s and 30s, and I was born here in Jacksonville. I knew I wanted to be in healthcare. I think growing up early on, it was very encouraged by my dad that I was going to be a doctor. He saw that I got straight A's. I was really good at anything I did academically. So he was like, yeah, you're going to be a doctor. So in those times, it wasn't something that I kind of had a choice. It was kind of like, this is what you're going to do. And it was reinforced. So in addition to my love for health and fitness, it just felt like this is what you do. It's the right track. And that's, you go to high school, you go to college, you become a doctor. There was always a track that was already predetermined for me. So it felt right. It felt like, not easy, but it felt like it was something that came with not a lot of effort.
What universities or colleges did you attend for medicine in your
So I did go to University of Florida, University of Florida for my bachelor's. Then I did pursue my master's, and then following that, I ended up going into medical school at Nova Southeastern in Fort Lauderdale.
Okay.
The interesting thing with that was I specifically chose to be an osteopathic physician because of the more holistic approach to medicine. While the training specifically for both MD and DOs are the exact, except osteopathic medicine offers some extensive training in hands-on osteopathic manipulation. I chose to be a DO because I wanted that holistic approach. It's always been kind of my motto in life, and as far as health and wellness. Exercise, eat the right foods, sleep, make sure you moderate the amount of substances and taking care of yourself. And so that was my decision to choose a DO program versus an MD program. And once I had started to practice, I really felt that passion for holistic lifestyle medicine to really come to fruition. I came to a point where all we were doing was prescribing pills, and that just and it was very much not mandated, but strongly encouraged by insurance companies, by big pharma, that this is how you treat high blood pressure, diabetes, cholesterol. So I found myself in this very conflicted way of being able to practice. Now that I spent 4 years of undergrad, 4 years of med school, 2 years of my master's, 3 years of residency.
That's a long training.
It's a long time.
It is.
And it's a long time of personal sacrifice, time, and patience to then later on turn around and be kind of, I don't want to say forced, but strongly encouraged that this is how you're going to practice. These are the rules you have to play by. And if you don't, then, you won't either get paid or there would be some sort of consequence. So that it just really made it very difficult for me to practice the kind of medicine that at the time I knew I wanted, but didn't know because this was all I knew. Growing up with a strong Asian background, as a female Asian, you didn't really have much of a voice. You were played down a lot. You didn't have the opportunity to feel certain feelings. It was always dictated for you. So going into medicine, which tends to be a very patriarchal type scenario where this is what you do, you don't ask questions, it just made it very conflicting for me. And
I find your point very interesting because for the people that are viewing here today, they don't necessarily understand the differences that you're talking about in terms of the medical approach that some people in your profession have towards those who are in the traditional forms of medicine.
Yeah.
And what I'm sensing from what you're telling me is that in a holistic osteopathic approach, there's a great deal more emotion and passion involved in the traditional sense as opposed to just prescribing medication or routines. And correct me if I'm wrong.
Okay.
I'm curious. What would you say to that?
Interesting. So yes, I went into osteopathic medicine because I thought it was more holistic, and it is in a physical form, meaning it understands that a headache is not just a symptom that you ameliorate with a pill. It understands, okay, it could be visual, it can be tension, it can be muscular, it can be hormonal. It takes into account more of the physical aspect. I do have a passion towards understanding the emotional, mental side of it. There is, for years, even in my own personal training, there's always been this stigma with mental health and emotions, and it's always put aside. You just, deal things, no emotions. There's got to be something wrong if there's an emotional. It's got to be a chemical imbalance, et cetera. And a couple years ago, I actually went back to school and to the University of Florida and obtained my fellowship did some fellowship training in addiction medicine. And I specifically picked addiction medicine because one of two reasons. One is, in my opinion, what mental health looks like when it goes untreated. So when we think of cancer,
that's very interesting.
When we think of heart disease, it's like, well, it was it was metabolic disease untreated, right? If you don't treat those now, you end up with a heart attack. If you don't find or do the right lifestyle changes with cancer, with lifestyle in general, you end up with cancer, right? Undiagnosed. Well, addiction for me has been, the experience itself has shown me that when mental health issues are not addressed early on, addiction starts to happen. I
think that's so important for people to hear.
Yeah, and it was the place where in my interview, I could talk about God. And in fact, it's the one specialty in medicine that God is encouraged. They talk about the serenity prayer. It's where we really start to embrace mental, emotional, and spiritual health. And so I felt in my 20 years of practice that the training I received in addiction medicine allowed me to incorporate that in a way that's acceptable to traditional medicine, but also acceptable for many people to understand that we are mind, body, and soul. And that is what my focus is in Vitality by Dr. Bago, as we reopen the Wellness Center that used to be part of a previous practice that I'd been in.
And you just opened this facility in 2025, Vitality by Dr. Bago in Wellington, Florida. And what you just said has always coincided with my conviction, my belief in finding a person of your quality and skill set that I don't care how much you know until I know how much you care. That to me manifests a very holistic approach to treating the individual who comes to you and complains about what seemingly is the most innocent or incidental illness or pain or difficulty, and how you would approach it from more than just a specific approach.
Yeah. When a patient comes in, or at least my experience is, yes, we all have these physical manifestations that come out, and they can be as simple as taking a Motrin or some sort of anxiolytic not anxiolytic, NSAID to help it to improve it, or some sort of med. However, chronically, what we're seeing is usually it's an accumulation of other things. And most physical manifestations can happen, like from cancers to heart disease. There's an emotional component that we start to identify as causative. And what was happening to me in the traditional sense is people would come with the same complaints. And until we address the person who sits underneath that physical body, I found we just kept going one step forward to go two steps back.
You're addressing the symptoms and not the cause.
Right. And it's really finding that. And there's.
How do you do that? How do you find that within a person? It's got to be, you have to establish a level of rapport and trust and get a level of vulnerability from your patient that they're willing to even become in touch with an unconscious level of themselves that they would not expect you to even go near.
So all of us live in this very masked world. We carry an armor. We carry
pretense,
a pretense, a mask, an avatar, a role that protects us from who we are at our core. And when we treat at that level, you can get somewhere. That's you're able to heal that person systematically, but inevitably there's going to be something else that comes through if we don't address it.
Maria, this is so refreshing to hear you say these things, because most people today who go to see their general practitioner, their doctor, they are in and they're out. In the very short time that they have to speak with their doctor, they may not feel that they're getting the personal attention that they deserve. To hear you sit and talk about healing and the approach that you have in your particular profession is so refreshing from the standpoint of the fact you're trying to treat the whole person and you're asking questions about them that may have nothing to do with a particular illness or difficulty or pain or suffering, but you're more inclined to understand who's the person that's sitting in front of me here and what can I learn from them about their whole demeanor and how it's affecting their health and well-being.
Yeah. I have, so what's coming to mind right now is a patient I had seen recently who was struggling with a lot of just sleep issues, a strong fatigue that happened to her at around in mid-afternoon. And it was interesting to talk to her about that because, if you have issues with sleep, there's a pill for it, right? There's a pill for every symptom and ill that we have. But as opposed to just kind of addressing it with that, and even going a little bit step further and saying, okay, well, now it must be your adrenals. Let's work on your adrenals. And from a functional medicine standpoint, by the time we were done with this conversation, it turns out she is a mother of 4, which I too had related to because I am a mother of 4, who has been burning the candle at both ends, taking care of everyone, children, not really focusing on herself, but also having issues with her own relationship with her own family members. What was interesting that we would have never found out otherwise without the appropriate questioning is her kids go to bed take a nap at around 2:00. And when there's the silence, all of a sudden, the things that we are running away from through the constant busyness of daily life start to come up. And those are heavy if they're unprocessed. And she happened to have an estranged relationship with her own daughter, her own mother. So as she's coming into a relationship with her own kids as a mother and still not having had to process whatever relationship or family issue she's had, she's finding that silence is very heavy and noticing that some of her symptoms, which if we just took care of with a pill, would never come to surface. And I lightly touched upon it because I didn't think she was ready yet to maybe come to that. But just to open up her eyes to the possibility that there's something else deeper. And she may not be ready to address that. Not everyone is. But it's being able to practice medicine at a level that's above
just
a pill,
prescribing
above doing just all these tests. It's being able to say, well, what else is going on? And I really enjoy that. So we can address, and we'll address it. Of course, I'll help her in many ways. But I found that satisfying, and I saw kind of like a little bit of an opening, a little crack. And whatever pains that we all hide, that we all place our armor, at least it was touched. It was approached. It was awakened. And if it's not fully ready, that's fine. And I find that most people, this is a journey. It's a journey that we all take. If we don't address those, we're going to constantly be handing people more meds. Oh, well, this didn't work and this didn't work. So now they're on 20 meds because they're tired, they're fatigued, they're gaining weight, their belly hurts. And I just can't practice that way. It's just.
And, Maria, I am so glad we're talking about this. I can't think of the number of people who could benefit from what you're saying and going to see their physicians, their healers, to look for assistance, insight, anything that's going to help them with a remedy. And we live in a world today where the pharmaceutical companies of the world have made inroads and have made tremendous amounts of money. There isn't a night on television where you don't see a pharmaceutical product being advertised for this or that, and then they immediately tell you the side effects afterwards. So
really fast, really small.
Exactly. And Maria, what you're saying is the 5 aspects of a person's personality. Their physical, the emotional, the spiritual, the social, and the mental are all affected by each other. If one of them is out of sync, the other 4 will be equally affected. You just can't address the whole body without looking at all 5 of these aspects and seeing how they are interrelated with each other and how they profoundly affect each other.
They do.
And as your role as a physician, to take that into account, is that holistic approach, which I've always admired in doctors like yourself who would be willing to go other than, well, just tell me where it hurts.
Right. The place for physicians and how we're trained, there is a place for it. The new medical facility that I've created through Vitality I call it integrative, because it's taking the good of what is traditional medicine, but combining it with functional medicine, but also integrating it with other holistic practices. By May of this year, I hope to have my full certification in acupuncture.
Congratulations.
Medical acupuncture has always been something I've loved. I wanted to train in, but never had the time managing a big medical practice that I had for 20 years. And it's the one specialty of medicine that there is good foundational medicine, medical literature to support it.
And evidence, yes.
And two millennial of experience. This is coming back from the French, from Europe, from China, Japan. We're talking about 2 millennial of practice that has served patients in a very holistic manner that addresses that energetic portion of our body in addition to the physical ailment and also helping that emotional. So it's got such a profoundness to it. I mean, the military use it all the time to be able to help with PTSD. It's supported and funded by a lot of governmental agencies. So it's there. You just have to be able to look into it. But our training in medicine has always been, a pill for every ill. This is broken. Let's fix. And there is a place for it. When you are need surgery or when you need something acute, yes, medicine is wonderful, but it's not for the everyday use. At the end of the day, healing is going to require, like you would like harvesting a garden, or growing a tree. It needs the nurturing. It needs the support. It needs the time. And
it's a beautiful analogy.
It does. Your
it
health
works.
is so.
If it was just a matter of adding fertilizer or pruning, but
Right.
it's the dimension of all of that nurturing and care. It's just not one particular approach to anything that says, I'm going to heal you or take care of you. Look how long it took for chiropractic medicine to be accepted in some quarters. For the longest time in the National Football League, there were no chiropractors on the 32 teams in the NFL. Now every one of the 32 teams in the NFL has a chiropractor on staff.
Yeah.
There's something about other approaches to medicine that were heretofore not previously expected or respected or be part of a regimen of healing, but now they're finding their way into, because so many, as you say, 2 millennia of sciences and medicine practiced around the world have been neglected or ignored or pushed to the side for the purpose of just dispensing pills or medication. There's other approaches to healing that continue to be researched.
Yeah, and it was interesting because you had asked earlier about what are some of the misconceptions of healing. And when I started to think about that, the 3 things that we tend to think about or that tend to draw us in the wrong direction as far as healing is, 1, we live in a world of immediate gratification.
True.
And what had happened with the advent of the pills is that things like opioids and benzos and there were certain antibiotics, right? They did help immediately gratify, immediately help. And that's great in an acute situation where there's pain, where there's urgency, where there's acuity. However, in that chronic nurturing, healing is going to require that time, effort, resource, and patience. It needs to. Effort needs to be put into it. Another misconception that I see when it comes to the whole concept of healing is also the idea that there's lack of suffering. And what do I mean by that? In life, it's through our suffering that we heal. And most of us feel like if we just avoid it, if we're just constantly happy, everything's fine and I'm good. But you're never going to heal from anything that's gotten you to that point until you're ready to open the doors and heal. Something as simple as a fractured arm, right? If it broke at one point and it healed on its own, but it's not functioning right, we need to go back and break it to realign it so that true healing can happen. That's what I mean by suffering. Sometimes we have to open the doors. We can't avoid it. And a lot of what happens, for example, with addiction medicine is there's an avoidance. It's avoidance through alcohol, drugs, stimulants.
Maria, this is so vitally important.
Yeah.
I'm so glad you have named your new place of healing Vitality, Dr. Bago, because you're onto something. That's an approach to healing that more people, if they understood what their options were today, would be coming to see you. Because not only are you in possession of knowledge, but options. And people always like options. Yeah. And as you say, sometimes they want immediate gratification. Take this pain away from me. What do I have to do? And they don't want to face the suffering. But what we're part of in life is understanding how our suffering shapes us. Yes. Without it, we don't acquire the degree of consciousness which we're being called to a next step to develop. We will stay in that same place until you can't take the pain anymore. Yeah. There's a phrase on a building that I saw once that treats alcoholics and drug addicts. When the pain of remaining the same becomes so difficult, so painful, that it overcomes the fear of change, we will change. Mm-hmm. So therefore, that suffering and that pain has a purpose for us. It takes us from one stage of our life to another. It opens a door for us to dare to go into the other room.
And in going in that new room is what allows for growth and expansion.
Exactly.
But
it's fearful. People are afraid of it.
Absolutely. Absolutely. And fear is what do they say? It's not
impediment. It's the hindrance. It's the obstacle.
It is
to change.
But it's the courage to face the fear anyway, because it's going to be there no matter what. It's, I call it, I refer to the burning bush because yes, burning, it's pain, it's suffering. But at the end, when you go through it, you will come out untouched and yet improved. You will come back stronger.
At peace.
and at peace. But it's the matter of going through it. It's scary, but when you go through, you become that stronger
And I
version
sense
of
that
yourself.
you walk with your patients
I do.
on this journey.
I do.
You walk with them. This is not something, goodbye, don't forget to write, send a postcard. You take this journey with them. That's why I think you are a wounded healer. You are a compassionate person. How blessed your patients are to have a doctor and a healer like yourself who's willing to sit down and talk to them about, well, how was your day? That question never gets asked. When you see some people who have so many patients lined up that they don't have the time to really sit down and have a genuine conversation with them.
So the concept of vitality, the mission behind me kind of coming back after I sold my practice. It was Premier Family Health. I had owned it with my partner. Then about just 2 years after COVID, I did take about a long sabbatical, a couple years sabbatical to kind of find myself.
And if you didn't find yourself, you couldn't help anybody else on the journey. I have a friend of mine once said, how can you be expected to lead people through the desert if you've never been there?
Absolutely. And that's, and it's funny you say the desert, because I refer to this time for me of that sabbatical of me being in the wilderness when the Israelites had left
years.
Egypt, and I embraced that time as a time to say, okay, God, what do you have for me? Because I have no idea. I felt like I was stripped of everything I thought was important to me and plucked out of what was comfort, even though I was not maybe at my core happy, but placed into the desert, into the wilderness to just, have my talks with him and have a coming to self to find out what it is that he has called me to be in this second chapter of my life. And I kept coming back to vitality. And I say that in that vitality for me is remembering that which was forgotten, to bring back life, that which we put away. And that is really my why as to why Vitality by Dr. Bago exists. It's a center, but it's a resource. It's a place of healing. My patients don't quite know that yet until they walk in, and there's a reason. It's like, well, what is it? Walk in and you'll see. And it's a place where they start to go, okay, I'm somewhere different. I'm in this realm where I can start to talk about what ails me.
See, this is why I think what you have been offering to your people, your friends, your patients, the people in Wellington and the surrounding community of Palm Beach County and otherwise in the area is so critical for what you're trying to do and what you're bringing to medicine, an approach that takes in the whole person. I'm so grateful that you're with us today. God bless you.